Hi, I'm Crystal Laura. I'm the volunteer director at Phelps Health, and I have Charlene Turner with me. She's the membership chair, and she serves on the auxiliary board. And then she also has some clerical duties that she performs as well, and the help cart. So she's going to talk about that in a little bit. So today, just kind of wanted to talk a little bit of the history of the auxiliary in the hospital. So the land that the hospital sits on, the original part of the hospital, was donated by the Lions Club in 1947. So if you're ever at the hospital, if you go to the flagpole and look on the ground, there's a little plaque there that says that the land was donated in 1947. So the hospital opened March 12, 1951. So the hospital is going to be celebrating 75 years next year. This year, the auxiliary is actually celebrating 75 because the auxiliary was formed February 17, 1950 to help get the hospital open. They helped do fundraising and the open house, and they even sewed some items to help get the hospital opened. So when we started, we had 78 charter members, and it was only women. Now we have over 144 volunteers. That includes life members as well and home sewers. So we had just one location on 10th Street when we first opened in 1951. Now we have 4 buildings on the main campus, 3 clinics elsewhere in Rolla, and then we also have clinics in Waynesville, St. James, Vienna, and Salem. Oh, I missed Vienna on there. And then here's how we raise our money with the auxiliary and what we've used the funds for. So we have the Lily Pad gift shop at the main entrance of the hospital, the Lemon Tree Grill. We don't have volunteers there, but we do receive the money from it, and we pay the bills, and then if there's anything left, then the auxiliary gets to keep it. We have the Repeat Boutique, which is our resale shop, and that's all run by volunteers. And then all of the vending and the sodas, hospital-wide or campus-wide, organization-wide actually, are owned by the auxiliary, so we receive commission and rebates. And then we have fundraisers, so we have different companies that come in, like we have like a linens fair, scrub fair, shoe fair, things like that, and we get a percentage of it. And then that's helped us to give over $3 million back to the community and the hospital in the past 2 decades. We have scholarships every year that we offer for clinical students. We purchase an ambulance, a stereotactic breast biopsy machine, the large LED sign at 44, specialty mattresses for patients with skin breakdowns, wheelchairs, and then we sponsor Camp Capable every year. And then here's our different volunteer services areas, the information desk, gift shop, Repeat Boutique, sewing room, clerical, chaplain, special events, substitutes, help cart, the volunteer program. So that's for students age 14 to 17 during the summer. And then we have a college student volunteer program. It's on hiatus right now, but I'm looking at bringing that back. And then at this time, I want to have Charlene come up, and she has some information that she wants to share with you about what she does at the hospital. Come on up, and let me give you this so they can hear you. There you go.
Thank you. I have been asked to tell you what I do and why I do it at Phelps Health. As to what I do, I have 2 jobs that I work. One job entails clerical needs, such as stuffing envelopes for mailings or sealing envelopes. I also put return addresses on the letters. Most frequently, I work throughout the hospital with a cart containing magazines, books, playing cards, crossword puzzles, and word searches. I go in rooms and ask them if they would like anything from the cart. Sometimes I get turned down. However, more often I get many smiles and thanks. This is truly rewarding. As I make my way through the hospital, I stop at waiting rooms and fill a folder with crossword puzzles and Sudokus for those that wish something to do. My number one reason why I volunteer is that I love to serve and help others. I enjoy getting to know the volunteers, and I find that I love to interact with them. I have made many wonderful friends. After your shift, you get a chance to eat a complimentary meal after your 4-hour shift. The hospital also has several volunteer luncheons where all volunteers are welcome to attend. There are amazing door prizes. You also get the opportunity to see those new friends again. I guarantee volunteering will leave you with a feeling of satisfaction and fulfillment from helping others. Thank you.
It's just a few short steps to become a volunteer. We have an application. I brought some brochures today. It's online. And then once you receive the application back, then you meet with the director, which is me, and discuss volunteer areas, set up orientation. And then we have some health requirements to be done through occupational health. Then you attend orientation, which is about 2 hours. And that's just a general orientation. And then we have a specific department orientation wherever you're going to volunteer at, and then you can start volunteering. And then we have some benefits here that you, as a way to say thank you. Obviously, I would love to pay everybody, but then that kind of defeats the purpose of volunteering. So these are kind of the ways that we say thank you for volunteering with us. And actually, the free meal up to $5 is actually $6 now. It's gone up after your 4-hour shift. Even when you're not volunteering, if you show your badge, you still get a 25% discount. Free coffee and tea while you're on shift, a free badge and vest. A TB skin testing is free. We offer flu and hepatitis B vaccines. 10% discount on the lily pad. If you volunteer in there, it's 20%. Appreciation luncheon in April, that's free. Quarterly luncheons, and they're free. The employee pharmacy, which volunteers can also use, that's a really nice benefit. And then we have an annual hospital picnic. And then just here's some pictures that you can see of volunteers doing different things. So just wanted to share that. And then I just have the QR code, and that takes you to our application. So thank you so much. We appreciate it.